Good morning. The invitation to share in the PNU talks is really an honor, as the Philippine Normal University is the country's premier teacher training institution. Maybe if I am not a doctor, I would have been a teacher, as teaching is one of my most admired professions. When my sister, the former executive director and provost of PNU Mindanao, and now the Dean for Academics, Dr. Adeline Costelo-Sayo, asked me a month ago if I can share to you our journey in raising a son with autism spectrum disorder. I agreed because this is a topic that is close to my heart. So, what is autism? Does autism remind you of the movies My Name is Khan, I Am Sam, or Rain Man? Or does it remind you of the TV drama series Good Doctor? Autism is a developmental disorder with a range of difficulties in social, emotional, and communication skills, which occurs in all racial, ethnic, and socioeconomic groups. It is a lifelong disability that starts when a person is born and stays with him or her in old age. Every person with autism is different to others. That is why autism is described as a spectrum. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, guides the comprehensive assessment team consisting of pediatrician, psychologist, speech pathologist, and occupational therapist in diagnosing ASD according to specific number of symptoms that must both be present and impairing everyday function. The take-home messages that I would like you to get from this talk should be in the next succeeding slides. As teachers, you are in a better position to observe your students' issues in behavior, issues in social communication, and social interaction. To receive a diagnosis of ASD, a person must meet all criteria in Part A, at least two of the four criteria in Part B, Part C, D, and E. For Part A, the child must have persistent deficits in social communication and social interaction across multiple contexts, as manifested by the following currently or by history. Number one, deficits in social economic reciprocity, ranging, for example, from unusual response to physical affection, lack of interest in engaging in shared play, such as peekaboo, no interest in nursery rhymes, difficulties with two-way conversation in school-age children, difficulties with sharing, turn-taking, greeting and farewelling others. Number two, deficits in nonverbal communicative behaviors used for social interaction, ranging, for example, lack of eye contact, lack of awareness of personal space, limited or exaggerated use of facial expressions, body language, and gestures. 3. The child has deficits in developing, maintaining, and understanding relationships, ranging, for example, lack of interest in playing with others, doesn't change behavior to suit the social setting, difficulties establishing and maintaining friendships. Part B. The child must have restricted, repetitive patterns of behavior, interests, or activities, as manifested by at least two of the following currently or by history. 1. Stereotype or repetitive motor movements, use of objects or speech, like head banging, flapping of hands, rocking, body stiffening, toe walking, repetitive speech, repetitive noises, or questioning, lining up items, open and closing doors, switching lights on and off. Number 2, insistence on sameness, inflexible adherence to routines, or ritualized patterns of verbal, nonverbal behavior. Becoming anxious when a familiar route changes, bedtime routines, insist on food being presented a certain way, or only its specific brands, dresses and undresses the same way, or wear only certain clothing. 3. Highly restricted, fixated interests that are abnormal in intensity or focus, like preoccupation with unusual objects, such as washing machine, vacuums, obsessive interest in a particular topic, preoccupied with a specific TV or book series. Number 4, hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of the environment. The child overreacts to unexpected or loud noises. Difficulties in coping in noisy environments, but underreacts to noises such as not responding to name calling, sniffs other people or objects, over or underreacts to pain, prefers bland foods, refuses to eat certain textures. So part C, the child's symptoms must be present in the early developmental period, but this may not become fully manifest until social demands exceed limited capacities or may be masked by learned strategies in later life. D. The child's symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning. And E. These disturbances are not better explained by intellectual disability or global developmental delay. Deficits in social communication and social interaction at 12 to 24 months are the most important areas to focus on when considering a referral for an ASD diagnostic assessment. RG's issues in social communication and social interaction manifested late. It was during the time that we left our two children in my parents' care. RJ was almost 4 then. 1 in 68 children worldwide has autism. In the Philippines, the estimated cases of autism rose from 500,000 in 2008 to 1 million at present. However, this number could be much higher since there are still lots of areas in the Philippines not covered, and you need to pay for the assessment. It is more common among boys, 1 in 42, than girls, 1 in 189. These are some of the frequently asked questions that you might be interested to know. What causes ASD? The cause is still unknown at present, but it is generally accepted that it is caused by variations in brain structure or function. Genes may create a susceptibility to developing ASD, but researchers have not identified yet a single trigger that caused ASD. There is no medical or genetic screening currently available yet. Do all individuals with ASD have intellectual disability? Some individuals with ASD have intellectual disability, while some have average or above average intelligence. Often individuals with ASD show an even pattern of skills, having areas of strength and other areas where support may be required. How do individuals with ASD communicate? Individuals with ASD vary greatly in communication skills. Some individuals are highly articulate and effective communicators. Some may never develop the language. Others may develop simple language, or some may not develop speech but may communicate with devices, signing, pictures, or writing. Those who communicate verbally may still have difficulties with the subtleties of language, such as tone of voice, knowing when to stop talking, and adapting their language to suit their audience, like my son RJ. For children with ASD who are nonverbal or have difficulties in communicating, speech pathologists are teaching them to sign for their needs or use an application device such as ProLoQ2 Go to assist them. RJ has ProLoQ2 Go to assist with his communication, and it has helped him a lot. I will be playing a video of how ProLoQ2 Go works.
My name is Tommy.
Dom.
My name is Rose. Hand mixer, give. Me. Hand mixer.
My name is Emily.
I love it. That was so cool. I love it. That was so cool.
Being nonverbal
Doesn't mean
We can't speak.
we want to show you who we are.
Anywhere.
And
anytime.
How does ASD affect a person during life? ASD is a lifelong condition. Most individuals will require varying degrees of support throughout their lives. The supports are unique to the needs and age of the individual. In Australia, the government set up National Disability Insurance Scheme, which assists individuals with significant disability in their daily life and to help them participate in the community and reach their goals. In the IS at the moment, funds for RG speech therapy sessions, OT sessions, therapeutic support including behavior support, especially now that RJ is adolescent, even swimming and piano lessons. So this is our son RJ. Looking at the pictures, you will never know he has special needs unless you see him in person and you get to talk to him. This is my husband Robert and my daughter Ara. I need to introduce them to you because we are together in this journey with RJ. When you are a parent, you always see the good of your child, and sometimes you miss to notice what is different about him or her. It took our family members to get our attention about the unusual behavior that RJ manifested. We were in denial then, but when medical experts confirmed that RJ is in the spectrum, like any other parents, there were lots of questions, apprehensions, and even guilt. We mourned for it. We mourned for the thought that he is different from Ara, from the rest of the kids. We mourned for the things that RJ has difficulty of doing, like playing dress-ups, Boy Scout activities, sleepovers, team sports, and other stuff normal kids enjoy. We mourn for our plans to give him freedom to achieve his dreams. We mourn for what he is missing now and mourn for what will never be. Guilt assails us from all directions. We want to throw a beautiful party for him, but he may not notice it. He may not be interested in the presents, struggles in interacting with the guest, and in the process, we have to bear seeing the sadness and sympathy beneath friends and family smiles. We want more than anything for RJ to experience what typical children do, and we feel guilty when we can't. But more often, it is too overwhelming to try it. Therapists want us to spend hours and hours of doing activities to help him. But we also need the job to pay for the therapist. We have another child who needs us as well. And we also need some downtime for ourselves, or else we will be crazy. We live in constant uncertainty of his future. None of us knows our future. But if you have a neurotypical child, like Ara, you can possibly be certain that with love and nurturing, she will have friends, be self sufficient, and be able to achieve what she wants. But with RJ, we don't know what and how to plan for his future. We don't know if we need to set up a special trust for him in the future. We don't know if he will be able to get a job or live on his own. We live in fear just by thinking who's going to take care of him once we are gone. With RJ, we realize that spontaneity is a thing in the past. We have to plan ahead on everything, from places to go, clothes to pack, foods and toys to bring. When RJ was young, RJ liked to eat food that is very hot. So it's pretty tricky when we go on holiday back home, as microwave oven was not available in our parents' house. It is good to note that we have supportive family members who were just at our beck and call for RJ's needs. We grow thicker skin. When you have a child in the spectrum, you become oblivious to the stares of sympathy, disgust, and curiosity. You see, when Archie was still a child, Sunday masses would mean going out of the church every now and then, as we could not let RJ stay in one place. And oftentimes, we have to endure the stares of the people around us. When RJ has meltdowns in the church, restaurant, park, airport, which can happen anytime, we could feel the questioning glances, as if we failed as parents to pacify our child. We feel indignant when we feel that we are being judged with our parenting, but at the same time, humbled and reminded on the times that I made judgment to others in public. Now RJ is 15 years old. Looking back, we can say that God has blessed us immensely by giving RJ to us. Looking at him now, we can say that he has taught us the following: acceptance. As mentioned earlier, we were caught flat-footed on RJ's condition. But we cannot go on feeling sorry, feeling guilty. We have to accept. We accept that this situation cannot be changed, and that is okay that he will not enjoy everything. We learn to accept that we don't have to include him to any activities or events for the sake of including. When we accepted his diagnosis, we felt at peace and then come to terms with the fact that we can't always do typical things with a child who is typical and is perfectly okay. By accepting, we now focus on circumstances that we can alter. We cannot change RJ, but now we can change our attitude towards children like him. We no longer bother what others may say. We care less about it, but we value the people who also accept RJ as he is. We make connections. When RJ was recently diagnosed with ASD, we are bombarded with opinions from everyone. Some helpful, but most of them are not. Many times when we are in a gathering, there were those who would tell us what to do and what not to do, how to handle him. I would remember there was one instance I blurted, "Do you have a child like him? If you do not have one, then you are not in a position to tell us what to do." Then we stop minding what others say because we believe that we know what is best for RJ. We are blessed to have supportive families, friends, prayer warriors all over the world to help us plod along, and friends who we know we can count on if we need them. We develop hopeful and grateful outlook. We are thankful for every small progress that RJ has. We rejoice when he's becoming more confident with his numbers. We rejoice when he can use the microwave confidently. He is getting better in playing piano, and he was asked recently to perform in front of the school community during their Athon Day, Cardine's fundraising activity to help families struggling this winter. He has excellent marks in interacting and empathizing to others, as well as excellent marks in resiliency and adaptability. Aren't these achievements amazing? 4 years ago, when asked what he wanted to be when he grows up, he would always say, "I want to be a church reader." And so we encourage him to read, read, and read. Imagine our joy when he was able to achieve his dream, to read in the Mass. We were so proud of him. With RJ, we are filled with love that we could never imagine. We are blessed to have him. Despite all the very challenging aspects of having a son in the spectrum, none of us will walk away from this life without having grown, from having loved him, and our capacity to love expands with every challenge we encountered. Years back, RJ has penchant for sunglasses or sunnies, and we would buy all the sunnies he would want for our peace of mind. Then he has penchant with One Direction band. He had 5 dolls of One Direction members, and for some time, they are part of us when traveling. Then his penchant for Santa Claus. So he had all kinds of Santa, even one coming from the Philippines. We have a good school support. We are grateful for the wonderful support that the school gave us, for allowing RJ to continue mainstream learning and to inculcate in his classmates and schoolmates that we all have a little spectrum and quirkiness in us, and that is part of what makes each of us a beautiful person. We are grateful for the inclusion practices here. 。 . . 。 . 。 . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . RJ is currently in year 9 and is on modified education program. Part of his curriculum includes candle making, cooking, woodwork, and grocery shopping. As I am speaking to you, dear teachers, I would like to thank you for helping us mold and raise our children. We develop resilience. What is resilience to Team Sayo? It is our ability to recover from setbacks, adapt well to change, and keep going in face of adversity. If there is an honors degree in resilience, my husband Robert will be a great contender. He has a very good job in Saudi Arabia, but opted to leave and temporarily forget his professional life when Ara and RJ were small. He is man enough to realize that one of us has to be RJ's shadow when he's young and struggling. He knows more on ABA therapy and child psychology than I do. He asks persistently RJ's therapist on other strategies if the tasks given to RJ are challenging for him. Would you know he can play all RJ's piano pieces so he can prompt RJ during his practice? And Robert could not distinguish a half note from a whole note before RJ started playing. Ati Ara has been supportive to her brother. When she was young, there were instances that she would wonder why our attention was focused more on RJ. But with explanation we gave her, she understood. Never does she raise her voice to RJ. She would consent RJ's hugs, kisses, poking and all. She even made research in year 10 entitled What are the emotional cognitive effects that parents have with children of ASD, which she received an award for it. RJ has improved a lot through the years. Smiling, happy, friendly. He still has issues in starting and joining conversation, but he is trying his hardest to say something nice to the person. So if you know someone with children in the ASD, tell them to find an autism angel to talk to, someone who has been there and can connect to resist comparing their child to everyone, to not neglect their other children, as they also need them. Even if it is a challenge, to make time for themselves, go out, have fun. They need it for their sanity. They need to savor the precious moments when their child masters something new or just having a good day. And they need to have faith that your child will be able to navigate his or her life's journey. I would like to end this talk with a quote from an author, Paul Collins, who also had a child with ASD. Autism is as much about what is abundant as what is missing, an overexpression of the very traits that make our species unique. Our days might sometimes be stormy, but RG's presence always reminds us to see the beauty in each one, to see the beauty in life with a son who is unique, loving, brilliant, and the greatest gift we could have. Daghang salamat, maraming salamat. Thank you very much.